A documented rise in mental health emergencies is playing out in our community in some ways maybe more obvious than others. Our collective horror learning about the Stoneman Douglas High shooter's behavioral issues, the shock of a respected police director's self-inflicted gunshot, the effects of isolation and loneliness during a pandemic. Some state lawmakers are working on bills to bolster that part of public health care that included fact-finding roundtables this week that you're looking at right here. We get an inside look today from two of the lawmakers at the forefront right here with us today. State Rep Hillary Cassel, Democrat from Dania Beach, repping parts of Broward County. State Rep Joel Rudman, Republican from Navarre, repping parts of the Panhandle. A lot of P's in there.
Absolutely.
Welcome, your first time with us, so
well,
happy to have
you.
And you are quite the veteran of This Week in South Florida. You know what's really interesting about our discussion today is you all come to this with a lot in common. You're a family physician, you have very personal attachment to mental health, yet you could not be more different. You are different parts of the state, different parts of the aisle. So since you're visiting our community, let me just ask you about that. I mean, is this a sign that we can see a lot of bipartisan work really does get done in Tallahassee, and this might be one of those things?
Absolutely, Glenn, 100%. As a matter of fact, that's why I'm all the way down here in South Florida, is the fact that I'm here to give a message of hope, not just to people suffering from mental illness, but to all your viewers as well. Because if they're anything like me, they're probably sick and tired of hearing about partisan politics. They didn't send Rep. Cassel and I there to fight. They sent us there to solve problems. And that's exactly what we were trying to do this weekend.
And you are part of these roundtables. And I know we talked, and we've known each other a little bit longer than today, but I was very surprised about what a personal attachment you have to this mental health issue as a whole that you've been very upfront with.
Yeah, you know, this conversation's personal for me. I was diagnosed with bipolar about 13 years ago. I was 4 years into my legal career, $160,000 in debt, and I saw and experienced firsthand what a lack of access to care can do with somebody in crisis. So tackling this issue, solving these problems so individuals don't experience the obstacles that I did is important to me on a personal level and as an elected official.
So obstacles can be a great big umbrella terms. We're talking about obstacles to, funding, healthcare, accessibility. What are you finding in these roundtables? Because I'm just going to go on the record. The legislature in Florida has been passing mental health bills for a long time, including, and just a quick shout out to Christine Hunchofsky, rep from Parkland, who is very much part of the mental health world there. But what did you learn that you can write up a bill with?
So, Glenda, this was our fourth roundtable across the state. We held them earlier in places like Destin, Daytona Beach, Orlando. So we've had 4 of these roundtables now, and it comes back always to 3 basic categories. There's always access to care. There's always issues with reimbursement. I mean, mental health is not profitable for our hospitals or for our providers. And then, of course, there's the issue with the workforce shortage that we're going to have to address as a legislative body.
So you heard a lot of these things as you were doing roundtables from the professionals.
Over and over.
So you have anything, you have a couple of bills, I think, that are already written.
Yeah, I do. Last year I filed 2 bills, one of them dealing directly with our workforce shortage crisis that would provide incentives to those individuals that are currently getting that level of education, that not only would they get some reimbursement or a loan scholarship forgiveness, but it would encourage them and require them to go back and provide healthcare in those community-based programs rather than going into private practice where we see such shortage.
So that's an interesting bill, because that bill was, and maybe not the exact bill, but something very similar was filed in the last legislature that kind of died on the vine somewhere. I know that's not a technical term, died on the vine somewhere. But do you remember that, right?
Absolutely.
Why, as a member of the party that's got the supermajority kind of dictating what gets through, why did that die?
So I was amazed as well, Glenna. When you look back at the number of bills we had in the healthcare silo, there's a lot of good bills there. Rep. Cassel had one tied up. I actually had 3 good bills that were tied up until the last committee meeting. So I think it was just the sheer volume of bills that were filed. Also keep in mind the fact that both Rep. Cassel and I were both freshmen. So when you join a legislative body, there's always a little bit of this feeling out. Does Dr. Rudman really know what he's talking about? Is this something that we need to investigate? And I think with Rep. Cassel and myself, I can't speak for other people. I think there was this feeling out process in terms of, do they know what they're talking about? And when you go back and look at the bills, These aren't the only good bills that died in committee. There were several others. There was a bill that would eliminate what was called step edits. So if you were on a psychiatric medication and your insurance tried to say, no, we want you on a cheaper medication, there was a bill that would have outlawed that process. That bill will also be coming back. There was another bill that would have helped patients reach their deductibles quicker in terms of buying expensive medication. So all of these are bills that you will see again in some shape or form.
So I guess the obvious question is, how are they going to get through now when you know there's going to be a whole session full of really important bills?
Well, I think the fact that we are working together, so we are part of an informal consortium of about 12 freshmen. So this
many
summer,
of whom were at that round table,
exactly.
right?
So we all saw the same thing. So during the summer, we've all gotten together and we've kind of prioritized. Well, hey, Rep. Cassel's bill was an important bill. Let's not muddy the water. Let's not block the works. Let's get this bill through. And the same with those other bills that I mentioned. So there's going to be more of a concerted effort to focus on these bills this year.
You know, I have to think of anyone who knows your face from this show knows you're usually here talking about property insurance because your knowledge is broad and deep on property insurance, and Democrats had put forth a lot of amendments for property insurance that just kind of went away, mostly because they were from Democrats. Do you feel, and I hope you will talk candidly with us, do you feel like this subject as well, mental health and those kind of bills that might be lost in the shuffle, might have something to do with partisan politics? Maybe not right here, but elsewhere in Tallahassee.
I think the obvious answer to that question is yes. The reality is when you're fighting the culture wars that were being fought last legislative session, specifically in the healthcare silo when it came to denying access to care for members of the LGBTQ community and attacks on a woman's right to make a decision about her own body, there's limited amount of time in a 60-day legislative session. And when those silos, those committees are filled with those type of culture war bills, good bills like mine don't have the opportunity to see the light of day because there's only so many committee opportunities to be heard. And when they're filled with a bill that takes the entire day, the entire agenda, a good bill like mine can't make its way through.
You know, interesting that you bring up what a lot of people call culture wars, because a lot of the components of those so-called culture wars might also be components of mental health bills. That's something I want to talk about when we come right back for a quick break, and stay tuned. We'll be back. We are back with State Reps Hillary Cassel, D from Dania Beach and Broward, and R, Paul Rudman. Did I just call you Paul? Joel Rudman.
Joel.
You look like a Paul to me.
It's okay.
Joel Rudman, Dr. Joel Rudman, who is from the Panhandle, visiting us both here to fact find and write legislation for mental health. Right before we went to break, hopped into my head what a big umbrella mental health is, and the so-called culture wars that have sucked up all the oxygen in the news world on a state level. You know, within the mental health realm is transgender issues and LGBTQ issues. And I wonder, as a conservative Republican, when it comes to providing accessibility and affordability to mental health, is that inclusive?
Absolutely, 100%. And Glenna, we were talking earlier about why bills get to where they get and why some bills die on the vine. A lot of it is you have to have a concerted effort. You know, when I first ran for office, this is my first elected office, the hardest thing for me to do was to get to 51% of the vote. I mean, 51 is a big number. The House of Representatives, you have to get to 61. So I think before, you know, when we were talking about certain bills and why they make it and other bills don't really seem to have a lot of momentum behind them, this year you're going to see that concerted effort behind our group of 12. As long as along with other legislators who weren't part of our consortium, but you're going to see a massive push to get these bills to 61 votes, to get them across the finish line, all aspects of mental health included.
And do you foresee pushback on that? Because there's some people come from a faith-based argument that's very hard to persuade otherwise.
So I really don't think the topic of mental health itself is actually very partisan at all. I just think it needs a coalescence. People need to get together and build bridges, and that's exactly what we've been trying to do this summer. Like, for example, you're never going to hear a politician go out on the street and say that they don't care about mental health, right? Everyone's going to talk the talk.
Especially now.
Exactly.
Especially
but
now.
You've got two representatives here that plan on walking the walk, along with others.
Okay, let's talk paying paying the price.
Absolutely.
So Florida, about 1 million people just lost Medicaid coverage recently. There is no Medicaid expansion. I know, listening to the roundtable discussion, you had talked about, floating an idea of maybe, paying for Medicaid, paying into it. What is that problem, that hurdle looking like to get over?
So that hurdle is the hurdle, the elephant in the room, right? We know that Florida is one of 10 states left to expand Medicaid, that's failed to expand Medicaid. 69% of Florida's children are on a Medicaid type program. We know that 50% of all mental illnesses are fully developed by the age of 14. The next group that's impacted by mental illness is 18 to 26. Those are individuals that likely fall into a gap coverage where they don't have insurance provided by their parents. So one of the bills, when we talked about legislation that I filed along with my Senate partner, Senator Berman, would look into whether or not we need to expand Medicaid for that, but that's something that needs to happen. The roundtables that we've all participated in, every single group that's participated, that is one of the top things that they say. Not only do we need to expand it, but we need to raise the rates for Medicaid reimbursement. They haven't been raised since 1990s. So we're asking our doctors to render services and care at 1990s prices.
That's a component, I think, of the bigger picture.
Absolutely.
Like
Glenn, if I could
you do that building. You do that billing.
Exactly.
Right.
And if I could piggyback on that,
Sure.
so she's absolutely right. I mean, something's got to give here. We call it a healthcare crisis. Well, when you're in the middle of a crisis, all options have to be on the table. We're one of the last remaining 10 states that have yet to expand Medicaid. This option needs to be put on the table. And I can tell you.
Why hasn't? What are the reasons that Florida has not? I mean, that's federal money. Why not?
Well, I can't speak for others. They probably have their reasons. But what I can tell you is these are not handouts. These are not giveaways. They're helping working families. And they're helping places like Baptist Hospital back in Pensacola. Do you know Baptist Hospital, for every psychiatric inpatient admission they have, they lose $4,500 a day per admission. So these are not money-making propositions, but they're necessary. You have to put your money where your mouth is.
One of the other ideas I heard on the roundtable was making mental health primary care.
Exactly.
You think that'll happen? 10 seconds.
I hope it happens. I think that's a key component, that we can get away from those pre-authorizations, that you can go see your primary care physician and that primary care physician can provide those services. We know that people have to take time off of work. If they have to go from doctor to doctor to doctor, that's complicated, and it prevents access to care.
100%. Mental health now almost mainstream. I hope now that we have a little bit about how the sausage is made, I hope you'll both be back when those bills are filed, and we can talk about them in real time, and you'll bring your guitar and maybe play us a song.
Bet.
Thank you so much. Appreciate you both.
Thank you.